K11 to K21 points we will see. K11 to K21 is the 11 points in one same sequence. Same sequence, one tune distance, but let me see where exactly the points are located. Now I just apply the K11 point is a Hengu. The Hengu is half tune lateral. From here we can consider 3, 4, 5. 5 tune below the navel and then half tune lateral to the central midline. But these muscles called as a, this the entire muscles called as a linea alba muscles. These muscles called as a linea alba muscles, but these muscles called as a rectus abdominis muscles. These muscles called as a external muscles, and this inside muscles called as a transverse abdominis muscles, but this inside muscles called as a oblique internal muscles. Now we will see that, but now we will look into only the portion which we call as a rectus abdominis muscles, or this deeper muscles are called as a transverse abdominis muscle, because this is the surface muscles. There is a one more fold. That folding muscles called as a transverse abdominis muscles. But now we are talking about the central line. Central line around 10 mm to 10 mm to 23 mm. That means is the 3 centimeter. From here to 3 centimeter means is 1 tune. Till 1 tune, 1 to 1.2 tune, that level, that muscles called as a linea alba muscles, these muscles. But these muscles, stomach meridian muscles, are different. Right now we are putting the needles from here to here only on the where it starts. It starts on the xiphisternum. Linea alba muscles starts from the from here to here. This muscles called as a linea alba muscles. This entire line bilaterally. This to be known as a. Now let me say Hengu point I just applied, and then we just apply, somebody apply the needles. Then again 1 tune proximal to this region. Yes, perpendicularly. Before before inserting the needle, make sure and palpate. You just palpate like this, and then palpate on the bilaterally. Try to find out there is the bladder is empty. If the bladder is full, then you need not to apply directly on the deeper level. That causes that touches to the cavity, pelvic cavity, and also which causing the problem and connecting to the bladder as well. But that shouldn't get the perforation hole. That causes the hematoma or some kind of the bleeding will happen internally. That will become the clot. Once you apply to the deeper level, that's the reason we shouldn't apply to the deeper level. We just apply to the perpendicular, but however slightly lower portion or the perpendicular or the upward direction, there is no harm. Then you just apply, yes, half tune. Better you can use the half tune rather than 1 tune for the safer side. You just apply now.
If clot happens, what? How do we deal with it?
Yeah, we have to deal it very pathetic situation, but we have to do the ice water local application for the longer time. Surgery may not be required. If there is the organ is not damaged, then we need not to go for surgery. Yeah, deeper level. If you use 1.5 tune here, that connect to the bladder directly, because the organ is located in beneath of these points.
And if you touch the organ, surgery will be required. Generally ask.
Yeah, not required surgery level, but patient don't allow you to prick to that level, because the viscera it touches, you will get very sharp pain, but you cannot allow them to apply to the deeper level. That needle itself says, when you insert the needle, maybe see, I just applied, I know that sense is there. This is not gone to the very deeper muscle, but only the superficial muscle is there, but the internal fascia is not connected yet. But once it goes, the fascia get connected. Inside of the fascia, that viscera is existing. Viscera means organ is existing. Therefore, we will come to know that. So now we just apply this, which point is it? So 11, 12, 13, 14, 15, 16. You just apply here 14th point. Then is this is the Salman point, right? This another Salman means is the Siman. Then here you just apply. Yes. This is as a Chungsu. This is as a Fu Chungsu. Chungzu, Sanjo 3 point also Chungzu, Sanjo 3 point also Chungzu. The another point is this is as a Shu Chungzu, this is as a Fu Chungzu. Fu means is the abdomen Chungzu. Then you just apply the Tian Shu point here. Yes, half chun lateral, half chun lateral to the navel, center of the navel. Here exactly, not there, here. Yes, right. Now the center of the navel is half chun. We can recognize these are the points. But now Hengu, Tahe, Chiksu, Siemen, Chungsu, and Huangshu. These are the 6 points we applied below the navel and lateral side of the navel. We just applied. This all the points are really good point to treat for the hypogastric artery, and then also this is the iliac artery and then iliac nerve are related to the anything is the pelvic related problem. Recognize these are the points are the kidney points, but in the infinity level I need to tell you, but extraordinary level you wanted to get the information. Remember, these are the points are treatable for the transverse abdominis muscles on the deeper level, because those muscles are connecting to the vertebrae. Those muscles, abdomen muscles, are holding to the back of the vertebra. Vertebra means is the bone. So that is holding the muscles. Do you know the Huato Chiachi? Chachi, you remember. Huato points. Huato points are existing where? Half chun lateral to the spine, the points are located. Remember, is the key research from my side. When you apply the back shoe points, that is half chun lateral to the spine, then you are treating to the spinalis nerves, you are activating. At the same time, you just apply the kidney move front points, that means is the half chun lateral to the midline you are applying, then you are applying to the back spinal nerves, and also front these points you are activating. I believe that, but you are doing the strongest job and the far most important job to treat for the upper and then middle. That means is the back and then middle portion of the abdominal region. You are treating Huato points, which the Huato Chiachi points is there, but this is the move front Huato Chiachi points. Hereafter we can consider this. Even you can write down in my book. So to be considered as a move front Huato Chiachi points, to be known as a, this is the kidney meridian points called as a move front Huato Chiachi points. We can recognize in this way, but no doubt the Huato is recognized on the back region only for the 17 points he recognized, but I calculated all the points to become the 33 plus 33, 66 points. Along with that, we can activate from here, that to be considered as a totally we can bring greater than 100 Huato Jiaji points. He told only the 17 points, but we can take up to the 100 plus points to recognize all the Huato Jiaji points as a supplementary point. I think I love this. कितना सुंदर, कहीं पे भी आपको लिखकर नहीं रहता है ये, तो वी आर गिविंग दैट इंफॉर्मेशन. ऑब्वियसली ट्रीट फ्रंट एंड ट्रीट बैक, होलिस्टिक वे you can treat, but 2 times you have to treat back, also you treat, and also you treat front, or the lateral position. 1 time you wanted to treat, lie down in the lateral position, then apply the needle, or the first you complete the prone position, then you later is the supine position. You just activate in this way. I think in that way you can treat for the front and back. You remember there is a point called as a Shanglio, Cilio, Chunglio, Sialio, Huyang. Which points I told you? Palio. Palio means 8 Leo points. 31, 32, 33, 34, 35. These are the points are located on the sacrum 1, 2, 3, 4, 5. Here is the sacrum points. How amazing. कितना सुंदर है ये. उसको भी लगा दो, इसको भी लगा दो. The front side having the problem, that to be taken care. You know that there is a pudendal now, obturator now, cavernosa now, and also hypogastric now, obturator now, need to be activated. Sacral now activated from the S1 to S4, but आप भी यहाँ पे लगा दिए. You just activate this point also, because pudendal now where it supplies, cavernosa knows where it supplies to the penile organ, it supplies to the ovaries, it supplies to the fallopian tube, and also uterus. then this applies to the testicles. But therefore, those you are activating backside, apply on the front side also to regulate. This is something is amazing, but the patient wanted to be successful treatment. Inshallah, the Almighty will give the great relief to the patient if you just activate both the points and front and back. Now, let me proceed for the another point to be known as a Shanchu. Now, where is the point? So, two chun. Here you remember there is a one chun missed here, but now two chun proximal to the Huang Shu point. Huang Shu means Huang Shu का मतलब है is the great vital. Huang means is the vital point is existing. Which is the Huang Shu point is Pao Huang Sipian, you know, UB53 point also Pao Huang, and then Kao Huang Shu, that is the UB43 point also Kao Huang Shu. जब मैंने उसके बारे में बोलता हूं तो बहुत important point UB43 I told. Then in this way the Huang Shu point also good point to treat for all the navel related disorders, navel displacement. जब आप touch करो pulse is there, that's a good indication, and it's shifting of the solar plexus up and down, it causes the dysentery and diarrhea condition, need to be activated, solar plexus need to be controlled, then use the both the points is good point. Or you wanted to use as a hara diagnosis, that to be known as a this as a hara diagnosis, but you just activate this point. Right, 1, 2, 3, 4. This to be known as the uppermost point treated for the lungs, and this treating for the spleen, this treat for the liver, and this treat for the kidney, this treat for the liver, this treat for the lungs. This is spleen, this is kidney, and the right side is the lungs, and left side is the liver as per the Hara diagnosis. So therefore you wanted to treat vicinity of this region, definitely have the great impact that you are treating to the organ related conditions of as per the Japanese acupuncture. So therefore now we recognize this is as a hollow. Once you put it as a castor oil in this region, sesame oil, or the olive oil, or maybe something is the mustard oil or the virgin coconut oil, you just apply any one, because each oil having the separate properties, and then massage to this region, obviously that having the great impact to treat for the solar plexus and Manipura chakra to be activated, along with that Swadhisthana chakra, this point to be known as a Swadhisthana chakra, that also to be known as a sexual chakra, then again it is known as a lower Tantyan. So lower Tantyan, all are connected here, such a powerful point over this region. Then do the moxibustion over this region, having the great impact.
Is it one shoot from navel, sir?
Yes.
Is it one shoot from the navel, sir? All the points?
Yeah. Yes, one chun, but it is not one chun, but you can apply the two chun as well. But this entire region, not the point, area. This area, this area, this area, this area. I selected 1.5 chun points here, but in that way we can activate the entire region. This I repeat, Hara diagnosis. This is the spleen point, and lower portion is the kidney point, and the right side is the lungs point, left side is the liver. But opposite here, left side is the liver, but not the lungs. So now we try to apply. Shanchu is over. No, right? So yeah, two chun. Thank you. Now two chun proximal to the half chun lateral, we just apply K17. This is called as a Shanchu, SHANCHGU. Then Shikwan, the kidney 17, and then 18. One chun again. K18. K18 is the Shikwan. Shikwan means is stone gate. Stone gate is existing over this region. Good. Yeah, you hold to the very neck region of the needle. Then the another point is Indu. Indu means, do you know what is Indu? So normally they call me Indu, please come. Indu means Indian. Hindu means Indian as per the Chinese language. So now you just apply as a Hindu, that is the K19 point, and the K20 is the K20. The point is Fu Tungu. Do you know Zutungu? Zutungu is which point? UB66 is the Sutungu. But this is as a Fu Tungu. Fu means abdomen. Tungu point. There is a human. Human 17, 18, 19, 20, 21. How many points over? 21 points are over now. And overall, these points are a good point to treat for the lumbar vertebra and also thoracic, especially thoracic vertebra. This point to be activated. Along with that, what are the indications we can use it? But at the same time, the right side you can treat for the liver and gallbladder and stomach related issues. On the left side you can treat for the stomach and then spleen related conditions. But by the way, right side you can treat for the pancreas and diabetes related. Whenever the patient feel the bloating, I do have the acidity. Acidity means is the acid reflux. Acid is going upward direction. GERD, gastroesophageal reflux disease. Then acidity goes to the upward direction, getting the burning sensation, nausea and vomiting sensation. There is a gastritis, there is the inflammation of the gastric mucosa of the stomach that gets the bloating and some kind of the anorexia, loss of appetite, and after eating they get little eating only, they'll get stomach is full. So all the conditions we can use this point as well. Now let me see.
19 to 25 also must.
Yeah, left side or right side you can use it at any side.
The stomach 19 to 25 also does the same. Also. Which one should
No?
like either this or stomach 19 to 25 also the same, like acid reflux and all it is.
Yes.
So should we, which is better, like this or
Left side better, you just use it.
stomach meridian points or this kidney meridian points?
Yeah, stomach points and then Renmai meridian points are good. Renmai and then stomach points is good, but this also as a supplementary points you can use it. Now there is a Bulang. Bulang is the most important point I just cover from here, but now I just see there is a mammary gland, and then this you come down. This is the central line. This is the central line, and this is the nipple region. Then this to be known as a stomach meridian, isn't it? This to be known as a stomach meridian, but now the point is located, that point to be known as a this is the stomach meridian here, but this not the stomach meridian. But now you can recognize the point is xiphisternum, and then this is the fourth intercostal space, and then fifth intercostal space. Now the point is located on the, you try to palpate, this is the muscles, this is the space midway between the two spaces. But now this point to be known as a Shen Feng. This is as a K 17 and then K 18, 19, 21, K 22 Bulang. You just apply here. Is the Bulang point you just apply. So Bulang point is good point to treat for the all the female related disorders, and also to get the menstruation also we can use this point. And also you are treating, now you are treating to the heart as well. You are not treating for the heart conditions as well, because do you know where the heart is located, from which vertebra to which vertebra, or the which rib to another rib? So where it starts. But aorta is existing on the C1, cervical, which we call as intercostal first and second intercostal space. But remember, the heart is started. This is the apex of the heart. This is the bottom of the heart to be known as this point. And then you just apply this point. Also good point to treat for the heart. This is as a Bulang, and this is called as a Shen Feng. Shen Feng is the kidney 23. Then Lingsu, the point to be known as a kidney 24. And then kidney 25 is the Shenkyang. Shenkyang is the kidney 25, and then kidney 26, and the this is as a third and second and first intercostal space. Then further kidney 27 is the last point, and below the cervical bone below the inferior border of the clavicle. This point is located, this to be known as a kidney 27, that point to be known as a shufu. Now you can recognize these are the few points you can recognize, but now the points you are using on the right side, that indicating you are treating to the pulmonary system. You recognize, but you are treating on the pulmonary system, but at the same points you are treating on the left side, that you are treating directly to the cardiac system. Remember, there is the points called as a cardiac system. Do you know where the heart is properly located on this region? The entire this region is located, but in this region, the above superior to the known as a aorta here, this is the pulmonary vein here, pulmonary artery here, this is the tricuspid wall, and this is a bicuspid wall and tricuspid wall. So this is the entire region. When you apply the points as a the Boulong point, but you are treating to the conductive system of the heart, what the pacemaker normally use for the normal regulation of the cardiac system. SA node, AV node, bundle of his Purkinje fibers that have the electricity passes in the heart system. In that way, we are using these points are connecting to the cardiac system. So you just use the points over this region to treat for the heart, but obviously that regulates the people gets the palpitation, insomnia, and hyper function of the cardiac system, and also hyperthyroidism. They'll get lot of heartbeat, and also anxiety, depression also gives the excessive heartbeat. In that condition, you wanted to use some of the local points. Better you can use on the left side, that would be better. But at the same points you wanted to treat, but you can treat for the lungs as well. Or you wanted to use the points lungs conditions, you can use the Kufang, Ui, Inchuang, and Ruchun, Rujen. So these are the stomach meridian points. You can use it to treat for the lungs related disorders. But this is the intercostal muscles, but intercostal arteries will be regulated by activating this point. So Shufu point is good point to treat for the lungs related disorders. When there is the problem, cough and congestion and asthma, you just activate this point regularly. 1 2 3 4 5 1 2 3 4 5 1 2 3 4 5 1 2 3 4 5. You activate, you can treat for the lungs as well. There is the sputum or the dry cough conditions. You wanted to use this point. Obviously, this is a good point to treat. Last point, but after the last point, kidney meridian is completed, just connecting to the pericardium as well. However, the kidney is indirectly connecting to the heart and also indirectly to the lungs as well. This is the last meeting point of the heart and then kidney as well. So we can activate that point to be known as a Shufu. So hopefully you understand. But now I'll wind up. But the